There are conflicting opinions tonight concerning India's battle against COVID-19. The government says its containment strategy has succeeded in holding infections to a particular level, but the numbers appear to tell a different story. More than 1,600 people have tested positive in just the last 24 hours. The total number of confirmed cases in India stands at 23,000. Now, 718 people have died. The Indian government says the increase is more or less linear and not exponential. But data shows the number of districts with the coronavirus has doubled. Testing has been increased 24 times in the past 1 month. Experts say more needs to be done to test, isolate and treat those with the virus. Neha Punya is in New Delhi and she joins us now. Neha, so it's been a month since the lockdown began. So why hasn't it slowed the spread of the virus as it's supposed to have done?
Linda, the government claims it has. It says that had this lockdown not been implemented and introduced when it was in the last week of March, by now India could have had over 800,000 coronavirus cases, and in comparison 23,000 doesn't sound like too much. The government's defense is there are two reasons for this increase in COVID-19 cases in India. One, they say this is the trajectory that the virus has taken in other countries as well, that there's a lull period in the beginning and then a sudden increase in numbers as the virus approaches its peak in whichever country it's in. Secondly, like you said, the government says it is testing far more people it is now than it was a few weeks ago. The government's estimates show that testing has been increased 20-fold and that it is now testing more people in red zones and clusters where COVID-19 outbreaks have been reported. And it's also maintaining that the rate at which the virus and the cases have doubled has increased from 3 days from before the lockdown to about 10 days now. But experts say while India is testing more, it's simply still not testing enough. Estimates and projections have shown that by mid-May, India could have about 1 million COVID-19 cases, and that's a worrying picture for a country that has a stretched public healthcare setup. We're also seeing not enough testing of everyone with symptoms. The government is still only testing robustly in red zones, but many experts are now saying there should be voluntary testing of everyone who has influenza symptoms, and they're saying that will help the government quickly isolate and test people, because it's quite possible many people who are showing symptoms now don't have access to testing facilities and they might be infecting more people than we know of.
So now the government feels that it's seeing some progress here despite the growing number of cases. At the same time, though, India's death rate has remained surprisingly low. That's defying trends that we're seeing elsewhere. What do you think explains this?
It is certainly an interesting statistic because if you look at the population of the country, 1.3 billion, yet over the last 3 months, the government has been able to keep the death rate at just over 700. And many public health experts say one of the biggest reasons for this is India's young population. Nearly 70% of all 1.3 billion Indians are below the age of 40 years, which means doctors say they have better chances of contracting the virus and recovering from it, which is why the death toll in the country is not as high. But many skeptics are also pointing out that it's quite possible that not all COVID-19 deaths are being reported as such. In many instances, elderly patients are dying before their test results come back or even before they're tested, which means that we don't know whether they had COVID-19 or not in the first place. The other problem, of course, is administrative. You have a massive lockdown that's now been in place for 30 days. It'll continue for another 10 and possibly even be extended beyond that, which is why many skeptics say that you don't have death records being updated as quickly. And that could be possibly why we're seeing such few deaths being reported. Of course, the government maintains it's still planning to test far more people. It's going to ramp up those testing protocols in the days ahead. So it's quite possible that as the peak approaches, these numbers could go up.
Neha, thank you very much for that update. Neha Punya there in New Delhi.